Hello, this is Dr. Gay from First Look MRI, and this is a 69-year-old female with complaints of knee pain. And this is just a very classic standard pattern of pathology we see. And so this is a knee working straight at the knee, and on this view we see there's bright signal. This is edema within the bone. This is the medial femoral condyle. Here's the lateral femoral condyle. The femur. Down here is the tibia, and we see a meniscus over here, a black wedge. Here's a meniscus to get oriented, and we see this abnormal finding that's pretty striking, lots of edema. We also see a band of darkness underneath the articular surface. So just in this one view here, again, since it's one of those patterns you recognize over and over again, this typically is related to a tear of a meniscus. Usually it's in the back of the meniscus on the medial side, in the root in the back or the posterior horn root junction, and the meniscus gets torn. When it tears, it drifts outwards and it's not doing its job, so there's abnormal mechanics of stress. And then you get a stress-type fracture. You get compaction of the bone underneath the articular surface. It starts to collapse, become dark and sclerotic, and then you have this bright signal reactive marrow edema. And you can also get this pattern with spontaneous osteonecrosis. If you have AVN of the hip, you can get a very similar pattern with lots of marrow edema. You can start to get a collapse of the articular surface like this. But so when we see this view, we're like, yeah, one of these two things probably. So we go backwards, we look for this medial meniscus root and posterior horn. And right here in this patient we see the back of the meniscus is dark, and right here we have this gap where it's bright, and this is the meniscus root over here. So they have this classic tear, the posterior horn root junction. We call it a radial tear. It usually goes all the way through from the front to back. Most often they have white fluid here. This is partially torn, maybe some stuff hanging on a little bit, but the meniscus looks like it's squirted out just a little bit and not doing its job. So again, this is a tear of the meniscus. The meniscus is not doing its job, causing abnormal mechanics of stress. We're getting a stress-related injury with marked marrow edema and this impending collapse of the articular surface. So really serious thing to find. And again, a very common type of a pattern we see. And that's it. Thank you very much.